Hey y'all. So I'm Dr. Kelly Clark. I'm over here at Patient PT, and I am making this video today to share a message that I end up sharing with a huge portion of the people who come through my clinic doors. And that is that you do not have to live with pain every day. You don't have to live with pain on a regular basis. You don't have to live with pain until you've rested enough that it goes away on its own. You don't have to take painkillers to address pain. You don't have to wait until your joint is so degraded that you need surgery to do something about your pain. Pain is a incredibly misunderstood phenomenon. Pain is a very important message that your body is trying to send you. And it takes energy and resources from your body to create that pain signal. Pain is something that happens mainly because of chemical messengers or nerve impulses that our body is sending to let us know that there is something not always wrong exactly, but maybe not quite right. And one of the reasons that a lot of times when people have pain that they treat with rest or painkillers, that just continues on for much longer than normal, is because that pain signal has not yet been adequately addressed. And unfortunately, a lot of medical care today is not so great about getting to the root cause of pain and really addressing what needs to be addressed in order to either make it go away for good or to teach the person who is experiencing that pain how to keep it at bay and maintain the progress that they've made to make it better. Wellness is a complicated issue. It's one that I've struggled with myself, and so is pain. And persistent pain, also known as chronic pain, is something that is affecting more and more people seemingly every day. It's a big reason behind the opioid crisis that everyone has heard so much about over the last many years. And even though that isn't something that is out in the press as much these days, a lot of that is because it's just a lot harder to get opioids. There have been safeguards put in place on medical care and insurance and things like that that make sure that it's a little bit harder to get those opioids, and so it's a little bit harder to get addicted to those opioids, but that doesn't mean that the pain is being addressed. And unfortunately, looking for the next surgery, the next pill, the next injection is what a lot of folks end up doing, even if they've just started out with a persistent achy pain. Okay? It may be something as simple as one muscle that has stopped working quite the way that it's supposed to, and everybody else is just tired of making up for their slack. That's actually what a lot of things you work on in physical therapy are. There's something that's too tight, something else that's too long, or something that's too weak, and something else that ends up getting too short and strong in response. Because the human body is really, in my opinion, the universe's most beautiful physics experiment. The joints in your body, they respond to the forces that you subject them to. And when you are subjecting those joints to things like injections and chiropractic adjustments over and over again, or even a surgical intervention that permanently changes the way that those bones relate to one another, I personally just don't think it makes any sense that the human body would evolve or be created in order to require that level of intervention just to deal with everyday pains. And since I finally got the diagnosis for the underlying medical issues that caused a lot of the persistent pain I was having for 10 years of my life, which, by the way, were just a couple of very simple vitamin deficiencies, I have slowly learned how to avoid virtually any pain that comes into my body. I very rarely take ibuprofen or any kind of painkiller for anything. And I love teaching my patients how to do the same thing. So if you have an acre of pain that you've been just dealing with, or you've gone to another healthcare provider and they've told you that it's some kind of itis or a frozen shoulder and you just have to live with it, uh, consider coming over here to Patient PT to talk to me about it. I know that there are some folks who get nervous about the fact that I don't accept insurance coverage over here, but the fact is there's a really good reason for that, and it's because when you are operating within the confines of insurance coverage, you honestly cannot give people the best care, and you definitely can't give them the best customer service. And that's what I pride myself on over here at Patient PT. I call my clinic Patient PT because I provide patient centered care. And I hope to just keep doing that for as long as I possibly can. I hope to retire from Patient PT someday. So if you'd like to come in here and talk about that ache or pain that has been bothering you that you can't seem to get other folks to take seriously, I'd be happy to listen. I'd be happy to check things out and see if we can do some massage or Graston or therapeutic exercise to get you back on track for the long term.